Hi, my name is Dr. Shouka. I'm a chiropractor here in Southern California. I've been in practice for over 20 years and I've seen all kinds of patients with all kinds of conditions. I've worked on people that could not even walk and all the way up to the elite athletes of the world. I've had one thing they all have in common is that they've all got some kind of scar tissue that settles in the muscles, ligaments, joints, and the fascia throughout the body. I've developed some expertise over the years in finding and detecting where the scar tissue is and releasing it. The problem with scar tissue is that if you put too much pressure on it, you'll develop more scar tissue. And yet, if you don't put enough, you can't get rid of it. So scar tissue is kind of like having a pebble in your shoe. So every time you wear that shoe, it hurts your foot. When you decide not to wear it for a while, your foot will feel better. And then you put it on again and it starts hurting again. Well, people with recurrent pains like a bad shoulder, let's say, they'll stop doing the activities that hurt that shoulder. They'll stop playing tennis or basketball or, just avoid certain movements. And after a few months or so, the bodies will kind of settle down and quiet down and they won't feel so much pain anymore. And then they'll think that, oh, they must be better. And then they get out there, and as soon as they start playing or using that body part, again, same thing happens, gets inflamed, and they're back to where they started from. So they weren't really any better. Just because they didn't feel the pain doesn't mean that they were better. And just because they had more pain doesn't mean that they were that much worse. It's just that inert scar tissue that's settled into their tissue, into their muscles and their nerves and their body. As soon as you start using that part of your body, it gets irritated. Another example is like a recurring tennis elbow or a tendinitis. You rest it, and then after a while it starts to feel better. As soon as you start to use it, again, you're back to right where you started from. So I use that concept a lot in my practice, even with spinal misalignments. People have scar tissue throughout their whole spine because the muscles of the back are working all the time. In every activity that you do, your spinal muscles are always working. If you hold your posture wrong for just, 30 minutes, you can develop tension and scar tissue in your neck muscles and your upper back. So scar tissue kind of wants to settle in and develop quickly and doesn't want to leave you. So over the years, you start compiling more and more and more in scar tissue. So anyways, with chiropractic adjustments, we realign the spine, but then if you have scar tissue in the muscles, they're going to pull it right back out again. And so that was a problem that we had to deal with in my practice. And what I found is that if I relieve the scar tissue and realign the spine, the adjustments would hold and people would get better. The thing that's interesting also is that when you release the scar tissue, you're able to reset the tight areas. The weak areas will automatically start strengthening. As a matter of fact, we know that there's that the fascia is live and it's filled with proprioceptors, and they are automatically resetting all the time. So as soon as you have any area that's tight, you're going to have opposite areas or adjacent areas that are going to become loose, or what we call hypermobile. Now the problem with the hypermobile or the loose areas is that they are weak. And traditionally with therapies and exercise, we try to strengthen those weak areas. But neurologically, they're shut down. So if you have a tight area in one part and a weak area in the other part, as much as you try to strengthen it, it'll continue to re-weaken. And we see that with people that manage their pain with exercise. Oh, as long as they're exercising, 3, 4, 5 times a week, they're doing okay. But as soon as they lapse a few weeks, right away, their muscles let loose and they're back to having pain again. The key is finding that tight area and releasing it. When you release it, your nervous system automatically starts to tense the other area. And that's how we create balance. And it's with that balance and harmony in your spine and throughout your body that allows your body to move properly. And so when it's moving properly, it won't break down anymore. It actually starts to heal. Here's a nice little example. If you can imagine that your joints are just perfectly shaped and you move your body properly, it'll actually make the joints healthier. But if your muscles have scar tissue and they're pulling the wrong way, they're going to grind down in those joints. And if you can imagine, that's what's happening in your spines, where the muscles are pulling the wrong way and beating down on those joints. Now, it doesn't matter what you do in there. You can put an injection, you can take a pain reliever, you can stick another joint in there. It's going to break down. The key is resetting the movement pattern so things work properly again. And I think that's why we have such great success with people that have had recurring pains, people with chronic pain. They try other modalities, other therapies that are helpful. But if you don't reset the nerves, if you don't reset and get rid of that scar tissue, if you don't reset the proprioceptors, all those therapies will fail because the body will automatically start grinding down those joints once again, and then you'll be right back where you started. This is my concept and my views on how scar tissue in the muscles affects movement patterns and how the movement patterns cause the joints to break down. And if that makes sense to you, give us a call. We're in Tustin and in Burbank. Our office in Tustin is located at 13691 Red Hill Avenue, and our phone number is 714-535-6535. I look forward to seeing you. Bye-bye.